people with sleep apnea often awake dozens of times a night, and they don't even realize it. Aside from daytime sleepiness, that puts you at risk for high blood pressure, heart disease, diabetes, obesity, and sometimes a stroke in the eye that can cause blindness.
Last December, I started getting headaches and I started seeing blurred vision in my left eye.
That would be concerning for anyone, but Richard Stripp is a forensic toxicologist who had already lost vision in his right eye in a laboratory explosion. So he quickly went to get his vision checked. The news was bad. Over
about a 7-day period, it degraded to the point where I only had about 12% of my vision in my left eye.
Dr. Rodwani Banik, neuro-ophthalmologist at Mount Sinai's New York Eye and Ear Infirmary, explained to me that Richard had had a stroke in the tiny artery in his optic nerve, and that it was Richard's sleep apnea that likely contributed to the stroke.
The hypothesis is that with sleep apnea, the airways collapse, there's not enough oxygenation throughout the body, and then that lack of oxygen and potential lack of perfusion causes the nerve to swell.
And that's what causes the loss of vision.
Yes, so the nerve begins to swell, and then some of the nerve cells actually become damaged or permanently damaged, and that's when the vision loss happens.
Richard knew he had sleep apnea, but wouldn't always use a CPAP machine that keeps the airways open and the patient breathing at night.
I never even thought of an eye stroke as something that I was at risk for.
Dr. Banik explained that while there are some clinical trials going on for this condition, there is no cure, and Richard's vision loss is permanent. He has a message for sleep apnea patients.
Be very compliant with your CPAP because while it may seem like it's a relatively harmless issue, it can be quite devastating if you're not taking care of it.
Now, to be sure, this kind of eye stroke is rare, but losing your eyesight is so devastating, and it's not worth the risk, especially when there are treatments for sleep apnea. The key is to get evaluated with a good sleep study, because often apnea patients don't even realize they have it. And even though Richard is now legally blind, he really has a tremendous spirit. He said, "This is my new normal. I'm going to keep going forward. I can work." There are so many different options for readers and things that can compensate for his loss of vision. So
it's life-changing, though, when these people get the treatment that they need. I mean, it's
absolutely,
it really is.
Absolutely. They wake up refreshed instead of being,
groggy
walking around
all
like
day
a zombie
long.
all day
And
long.
how difficult is it to get checked out? People are thinking they might wire themselves up.
Well, that's a full sleep study. There are now a number of different options for home sleep studies that make it a lot easier and a lot simpler to get it done and get it checked.
All right, good to know.
Thank you, Dr. Max.